Okay, so we're gonna just start off on our back. This is gonna be about 50 minutes or so. We're gonna start with a bit of a short posture routine and then just kind of blend that in with some movement. We're just gonna be focusing on shoulders, thoracic, neck release with rib cage and some rotation. Okay. So lots of the good stuff. Yeah, especially for you. And what you're gonna need, like I said, you're gonna need the chair or a futon about your knee height. You're gonna need the wall. You're gonna need cushion, tight strap, like a yoga strap, and a short loop band that's quite lightweight. Okay? Okay. Usually I'd get you to have the foam pad or a block under your head, but it won't matter too much because you're not going to be in that position for much longer, but you have a block, that's fine. But we're actually going to use our hands to support the head on the floor today. So we'll manage without the block. Okay, so first thing we're going to do is we're going to come lie down in a static back. Calves just to the top of your chair or your futon. Making sure that you're nice, 90 degrees. Knees just above the hips. Ankles in line with your knees. I'll just move this cushion over to this side. And if, like me, you've got your hair up, just obviously make sure it's not obstructing the back of the skull. We're just gonna ground down just for a few moments before we start in our static back. And then the first thing I want you to do is with the base of your palms, just start sort of like rubbing up the thighs and back down. So we're just using our senses here just to connect into the body. And as you're doing that, I want you to breathe in through the nose, expand the belly. And exhale through pursed lips. Gentle strokes, inhaling. Exhaling, palms rub up. Once again, inhale, letting go of tension in the legs, the inner thighs, your abdominals, across the shoulders, the chest. Exhaling, palms rub. Good. And one last time, long big breath in. And a long big breath out. Good. And then what I want you to do is I want you to interlace the hands in whichever way feels kind of natural and normal. And then in a few minutes, you're going to switch it so that the index finger of the right hand is underneath the index finger of the left. Most people will have the right index finger above the left when they first cross. So just make a note of that because you will switch it. And then I want you to bring the hands just underneath the skull with your elbows wide. So your hands are interlaced behind your head in this static back position. And then what I want you to do consciously is feel like it's not so much in doing, it's more a feeling of like your ribs are just settling to the ground underneath you. And then I want you to just have attention to the jaw, the mouth, the neck, back of the neck, your wrists, your forearms. Notice any tension there may be there. And just try and let it release on its own just by virtue of you having your hands behind your head. And then we're just going to breathe here, inhaling through the nose, belly rising. And exhale through pursed lips. And again, inhale. And exhale. One more time, big breath in. Keep your feet relaxed and toes relaxed. And exhale. Good. And then what I want you to do is pick up your head and lift and turn the head to the left with the left ear just resting very gently into the left palm just a little bit. So you're going to be looking over to the left. We're going to start using our eyes for a little bit of sensory input. And just with your eyes, I want you to look into the left quadrant of both your eyes. So you're looking down towards the crease of your left inner elbow. Just with the eyes, you're going to switch them and look to the right. So now you're looking up towards the ceiling with just your eyes. Down left. To the right, up towards the ceiling with just the eyeballs. It can instigate a little bit of spinning because it is for me. So if it is for you, just take a minute. And then down left with the eyes and hold your gaze. And breathe in through the nose. Exhale through the mouth. Now, with your gaze still to the left, I want you to drop the right elbow down towards your right pocket with your left elbow tilting towards the top left of your mat. So you're in like a little bit of a sort of lateral shift, if you like, but your sacrum's still to the floor. Back of the elbows and shoulders are still to the ground. You're just lengthening through the left side of your body here. And breathe again, inhale. And exhale. And again, inhale. And exhale. Good. Bring yourself back to center. Head will release back to center also. So your gaze is up towards the ceiling. Stay here for a second. Long, big breath in. Long, big breath out. And then you're going to switch that interlace. So if you had your right index finger above the left, I want you to bring it below the left. And then take your hands back behind the skull. It will feel a bit odd. So just give yourself maybe a breath just to feel like you can settle into that. Maybe feeling something just around that sort of right armpit area into the right forearm, wrist releasing. Exhaling. And then we're going to pick up the head and look over to the right side this time. Just observing if each side feels different. That's quite normal. First thing I want you to do is release the mouth. Feel nice and easy in the jaw, the tongue is loose. And then let's take a breath in here. We're just going to look towards the inner elbow crease with our eyeballs. So down right with the eyeballs. And then up towards the ceiling, left. And notice if it's different. So I felt quite dizzy when I looked up with the eyeballs to the right on the other side. When I do it on this side, I don't feel dizzy. So clearly there's an imbalance in my vestibular system, and this can impact the rest of our body right to left. So working our senses like this can be super powerful. Eyeballs drop to the right side. And then up to the left. Down to the right. And up to the left. And then down to the right as we tilt the left elbow down towards the left pocket. The spine, the shoulders still staying down on the mat. Right elbow will feel like it's reaching for the top right corner or the back right corner of your mat. And just breathe here. Inhale. Exhale. Big breath in. And exhale. One more time, inhale. And exhale. Really good. Bring your head back to center. Undo the interlace, release the hands. And then repeat the interlace, but with the hands just above the chest, palms facing your breastbone. So arms reaching up towards the ceiling. And then from here, we're going to work a 3-stage movement. We're going to inhale, tuck the chin towards the throat. And then as we exhale, we're going to reach the arms up towards the ceiling, protracting the shoulders. Bring the head and the neck off the floor, shoulders slowly off the floor. Bring the navel down towards the spine. And then inhale to lower. Back of the head to the ground, inhale. Exhale, tuck the chin down towards the throat. Slowly curl up in a gentle cervical flexion. Feel like your arms are guiding this movement. So you're reaching up from the shoulder blades rather than feeling like a crunch in the back of the neck. Inhale, lower. And then exhale to lift. See if you can reach 1 inch higher. Inhale back down. And exhale to reach. Good. All I want you to do is start rotating the arms towards the left, just in an angle above your left pocket. Keep the core engaged, navel pulling down towards the spine, but your legs are relaxed. Inhale, the arms back to center, head down. Exhale, roll the shoulders up, chin down towards the throat, lift from the shoulders, navel draws down to the spine. Start to drop the arms down towards the right side, right shoulder blade staying off the ground. Inhale back to center. Good, and then just take the hands back behind the skull, elbows wide. Just laying here in your static back again, opening through the chest, allowing the neck just to settle. Let's take a nice long big breath in here. And exhale. One last time, big breath in. And exhale. Good. And now I want you to just pick up your left leg with your left foot flexed, left knee slightly soft, as you bring the left knee more over the left rib cage. So you can see here how much my left knee is bent, just to allow me to feel like I'm flexed in my hip. But I want you to dorsiflex or flex that left ankle enough to feel like it's flat towards the ceiling. Elbows wide, hands just stay behind the head. And then from here, what you're going to do is you're going to turn the heel to the left with the toes turning to the right. So we're going for a bit of internal rotation here with that left hip. And then tap the left heel just to the top left corner of your futon or your chair. And then leg back up. You should start to feel something happening in the left hip. It could be cramp. It could be sort of like a real sort of activation there of the left hip. Left heel taps the top of the left corner of the box or your stool or chair with the toes turning to the right. Left foot up towards the ceiling, inhale. Left foot turns. Left heel taps top of the box to the left. Amazing. We've got 4 to go. Inhale, left foot back up towards the ceiling. Turn the foot first to the right. And then tap the left heel, top left corner of the box. Up, inhale. Amazing. Left heel taps the top left corner of the box or the chair. Back up, inhale. Exhale. Tap the box. Good, we've got one more. Inhale. And then exhale. I want you to gently just tap and hold the left heel just to the top left corner of the box, with the foot trying to turn towards the right side of the room. And then with the hands interlaced, you're going to take a nice long big breath in here. Exhale, just wrap the forearms around the side of your head. Exhale the head off the floor to lift. And then just turn in a thoracic rotation, the torso to the left, with your right arm now reaching towards that left ankle. Good job. Right hand behind the head, hands to the floor, head to the floor, big breath in. Exhale, wrap the forearms just around the temples, and exhale to lift. Turn the shoulders to the left, keep the left shoulder blade lifting off the ground. Reach the right arm across the left thigh and towards your left ankle. Long big breath in, last one. And exhale to lift. Turning to the left, right arm outside. And then I just want you to pick up the left leg and hold here. 5, 4, 3, 2, and 1. Release. From here, I want you to just lower the left leg outside the left side of your box. Keep the left toes up towards the ceiling. So we're in a really deep sort of external rotation, but more hip abduction with the left leg. And then I want you to just bring your arms in goalpost here. Maybe the back of the wrists just landing to the floor. If this feels quite sort of strenuous for the shoulders and the rotator cuff, you can drop the elbows a little bit to keep them in a soft W. Left foot stays really nice and firm, active with the left foot, and breathe. Long, big breath in. Long, big breath out. Long, big breath in. And long, big breath out. One more time, long, big breath in. Long, big breath out. From here, I'm going to get you to just turn over to the left with the right inner sort of knee, I'm going to say shin area, inner calf on top of the futon, and the left outer calf to the floor. So you're in a little bit of an awkward rotation, but the left shoulder pulls underneath you with both your hands off to the left side of your mat. Your head can be down to the floor. If you're struggling to get the head down, just put a block or a cushion underneath the left side of your head. So imagine your upper spinal floor twist, only we've got the right knee, the right inner foot on top of the box. And then just breathe here. It's a really big release for the right side of the shoulder, top of the neck. Inhaling. And exhale. I want you to feel like that right thigh, the right hips just dropping into the top right of that box. And exhale. So getting a bit of a release here in the pelvis before we start working this thoracic rotation drill. Long, big breath in. Long, big breath out. Good. From here, I want you to start sliding your right hand. Just going to take my glasses off. In protraction. So the right arm's going to reach for the right, sort of in front of the room. As you bring your nose down towards the mat or the floor just a little bit, and I want you to hold here. Breathing into the back of the ribs, breathing into that lower sort of waistline. I feel this in my right side of the SI and in my right hip too, so if you're feeling that, that's also very normal. Good. And now, as we rotate, I want you to circle the right fingers above the head as you feel like you're taking off a t-shirt and opening the spine to the right side. The arm will then swing to the right, head faces the right, and then travel all the way full circle back to your starting position. Right hand stacks above the left. First, you'll protract the right hand away, bring the nose down to the floor, inhale. And then as you exhale, circle this right arm. Look at my right elbow, it's soft. So I'm really feeling like this pull up with my rib cage on the right as I circle all the way back. Right hip stays closed into the box, right knee into the box as I come all the way around. We're gonna go for 2 more here. Inhale, reach the right hand forwards in protraction, and then exhale, reach that right arm back in a circle. Amazing. One more time, long big breath in. This feels really good at my thoracic, my shoulder, my ribs, even the top right side of my neck. And then reach it. All the way back and up. Good. And then you're going to get to about 3/4 of the way where you really feel the pec. I want you to just hold this position, but with the right arm off the floor and in line with the side of your face. Okay, so you're not trying to get that right forearm down to the ground. And I want you to just hold it here. Keep the head turned to the right. Left arm can just stay out to the left and just hold. Long, big breath in. Long, big breath out. I can also feel like this is untwisting my pelvis. I feel it really intense into the right QL area. So just hold it here. Amazing. And then bring the right arm down to the right side. So your arms are in about a 45-degree position. And then I want you to just pick up your left leg and cross it above the right thigh, but in an awkward sort of diagonal. So your legs are going to be facing the left, and then just turn your head to the right. You'll feel this in the left kind of waistline area. Just breathe, and then bring the right ankle towards the front edge of the box as you start to gently drop the knees over to the left. It's a really nice sort of gentle release here. You'll start to hopefully feel the outside of the right IT band area when you drop the knees. Just breathe through it. Inhaling, exhaling. Big breath in. Exhale. Last one, big breath in. And exhale. Good. Just bring the legs back onto the box. Come back into your neutral position. I'm going to put my glasses back on, otherwise I can't see. You feel okay?
Yeah.
Good.
Feels great.
You will probably start to feel like one side of the back of your pelvis is different to the other, and that's a good sign. So just stay in the static back for just stay in the static back just to let the pelvis kind of settle. Let's take a nice long big breath in here. Exhaling. I also feel like my head's a little bit further down to the ground, like underneath me. I don't know if you feel an adjustment in your neck. And I feel like my jaw is super loose, and the muscles around my mouth have released also. Good. We're going to go for the other side. So just take a minute. We're going to reach the right foot now up towards the ceiling. So bring the right thigh over the line of the rib cage first. As you flex the foot, you're going to feel the hamstring release. So just keep the toes splayed here. Just give yourself a second. Relax your abdominals. Relax the pelvic floor. Keep that left leg really loose on top of the box or the chair. And we're just going to breathe here for a second. Inhale. And exhale. Noticing whether the right leg feels tighter when you lift it this way compared to your left. My left felt a lot looser in the hamstring area, but tighter in the quad. Okay, and then from here, we're going to start turning the foot. So the foot's going to turn, as well as the leg, to the left, with the heel pointing to the right in the flexed foot position. And then you're going to tap the right heel to the right side, front corner of the box. And then up again, inhale. Wow, right hip singing. Exhale, turn the foot. Right heel taps front right of the box. And as you do that, try and observe whether you're tilting in the ribs. So I can feel a very slight tilt in my rib cage. So I'm going to plant both my hands on my ribs so I'm not cheating in this hip. So big compensations can happen in very small ranges of motion. So we're really trying to observe where we start cheating. So we're going to try and prevent that. Yeah, I can feel that so different in my hip as soon as I hold the ribs nice and steady. And then up again. Turn the foot to the left. Tap the heel to the top right of the box. Up again, inhale. We've got two more on this side. Exhale. Tap. Inhaling. Good, and tap. We're gonna hold that right heel. My hip is cramping. Right heel just taps the top of the right side of the box, and we're just going to hold. Big breath in. Big breath out. Keep those ribs nice and steady. I can also feel like I'm kind of curling into my lower back, so I'm just going to feel like I can adjust my sacrum to the floor. I'm not going to use my shoulders. If you need to stay here for a couple of seconds longer just to feel like you're neutral in this position, go ahead. This is super interesting for people with pelvic disparity and rib cage disparity, because your ribs will start to cheat, as will your pelvis, when you start to use your hip. Big breath in. Big breath out. Big breath in. And big breath out. Okay, and then we're going to interlace the hands just behind the skull, elbows wide. We're going to go for that oblique core routine before we start into that rotation drill. Long, big breath in. Exhale, wrap the forearms just around the temples. Draw the navel down. Exhale, the head and shoulders off the floor. Good. And then rotate, trunk to the right. Left arm reaches just outside your left thigh. Left side is completely disengaged, so really try to isolate this movement in one side. Inhale, elbows wide. And exhale to lift. Turn the shoulders to the right. Left hand outside your right thigh. Hand behind the head, inhale down. Good. Exhale to lift. And turn to the right. Keep the right shoulder blade off the floor. Reach the left hand across the right thigh. Amazing. Last one. Left hand behind the skull, head down, big breath in. And exhale to lift. Really good. Turn the shoulders to the right, left hand outside. And then just pick up that right leg. Hold for 5, 4, 3, 2, and 1. Release. My right hip is singing. Okay, we're going to release that right hip now. We're just going to abduct the leg. So we're going to drop the right leg out to the right side. Now, for me and for anybody with pelvic disparity, what you will notice straight away is possibly that the left side of the sacrum wants to lift off the floor. If that starts to happen, I encourage you to move slightly closer towards the box and just limit the degree of sort of the abduction on that right leg, just to try and keep the sacrum neutral both sides, okay? You will feel it. For me, this is very obvious. Like there is definitely a difference between the right side and left side of my pelvis. And then I'm just staying here to breathe just for a second. Right foot is flexed. It's kind of like an odd supine groin kind of release. And try and keep that left leg really nice and quiet. Long, big breath in. Long, big breath out. Long, big breath in. Long, big breath out. Long, big breath in. And big breath out. Really good. Say from here, we're going to turn towards the right side. So left inner foot and left inner knee, if you like, will come to the top of the box, and the right outer leg will land on top of just on the floor. Pull the right shoulder under with the side of your head just landing on the floor in that kind of awkward upper spinal floor twist setup. Let's just hold here for a second, releasing the top left side of the shoulder. Big breath in with the left palm stacking above your right. And in this position, just an observation, I want you not to try and sort of press the inner left foot into the top of the box. I want you to just try and relax it. And also notice if you're kind of arching in the lower back or trying to sort of compensate by putting an anterior sort of position in the pelvis. Really feel like the tailbone can stay neutral so that we can use the rib cage to full capacity. Let's breathe in through the back of the ribs here. Inhale. Exhaling. And then from here, we're going to slide the left hand forwards with the nose coming into the floor. Long, big breath in. And exhale. We're going to do 3 breaths here before we start our rotations. Big breath in. Exhaling. Big breath in. And big breath out. Good. From here, slide those fingers towards the top of the wall as if you're taking off a t-shirt, soft left elbow, turn with just the trunk. Left knee stays in the box. There's an intention as to why that knee is in this position on top of the box. It's to prevent us from turning from the pelvis. We're really turning from the thoracic and the trunk. And then reach the left hand forwards, inhale, nose into the ground. Exhale, reach it up from the rib cage. So imagine your elbow is pulling up towards the ceiling with the elbow soft as you rotate. And back. And maybe the pec on one side feels different. Maybe the rib cage feels different. Left side feels a bit sticky for me actually. Reach the left arm forwards, big breath in. Exhale, round. I can feel lots of clunkiness in my left shoulder. And then reach, left hand forwards. And all the way up. Amazing. Last one, reach the left hand, nose into the floor. And then up, and this is where we're gonna hold. So I want you to see that my left arm is about, I'm gonna say 4 or 5 inches off the ground, but I'm not sinking down into the chest. I really want you to feel like someone's pulling the hand away from the body towards the wall, and you're just gently looking over to that left side. Long, big breath in, right arm's reaching out to the right. Breathe through the ribs. You should be able to feel this all the way down towards the left kind of psoas area, the left waistline, maybe the left hip, but certainly into the pec and the side of the neck. Good, and then just land that left arm, maybe T position, maybe a bit lower, just in a place where you can get shoulders to roll down to the floor. And then you're gonna bring that right ankle, top of the right thigh. And then just start to bring the left ankle forwards as you drop the knees to the right. Really feel my left hip here. Head is turning to the left, just breathe. Inhale. Exhale. Inhale. And exhale. One more time. So good. And release. Again, just lay back in static back just for a reset. Very quick moment. Maybe this time you can bring the feet and frog, so soles of the feet together just to the front edge of the futon. Velcroing the soles of the feet together, let the knees just drop out. And then just bring the arms down 45 degrees, palms up. Let's just hold this for a few minutes. Just as a transition. Relaxing those hips, relaxing the inner thighs. I've got a big cramp in the left arch of my foot. It's very normal, but also very intentional. We're trying to wake up the feet in this position. 30 more seconds. Amazing. And then from here, what I want you to do, keep the plyo box or your futon or box, wherever it is. I want you to just come onto your belly, but I want you to wedge your knees into the sort of edge where the mat and your box or chair meet. And I want you to come down onto your belly with the front of your shins just into the front of your box. So you're lying prone in this position. Sometimes microphone kind of cuts out, so I'm just gonna put it off to the side. And then what I want you to do with your hands is you're gonna stack the right palm on top of the left, and you're gonna bring the left ear into, or the left side of your head temple into the top of the right palm and look over to the right. And then I want you to point your feet. So we're gonna have feet active in this position, but we're simply encouraging a little bit of extension in the hip and some plantar flexion with a really gentle sort of release of the rib cage here with a bit of rotation. And I want you to just relax the mouth, the jaw, and breathe here. Inhaling. Exhaling. Inhaling. Exhaling. I don't want you to inadvertently squeeze the glutes, so really feel like you can just activate the feet in the plantar flexion, so feet pointed, without activating the glutes. If they activate on their own, that's fine, but I don't want you to feel like you're squeezing the glutes. Let's take one more big breath in here. Good, and exhale. Now, I want you to release the right hand, lay your head down into the top of the left hand, and then bring your right hand behind your skull. So you're like sandwiching the skull just between the back of the left palm and the face of the right palm. And then from here, without lifting the head, I just want you to open the right elbow up towards the ceiling. So it's going to be a huge opening there into the chest on the right side, but also maybe in the front of the psoas on the right side. And just breathe. Inhale. Exhale. Inhale. Exhale. One more time. Inhale. Good. And now we're going to try and lift the head off the left palm. Keep feeling like you can draw the navel to spine. You're pushing into that left forearm just to lift a tiny bit. You're not going to go very far. So you're going to activate the left side of the waist, but open into the front right side of the chest. And then inhale down. And exhale to lift. Good job. Inhale down. Good, and exhale to lift. And then just reach this right hand for your right heel. Look over to the right side, breathe. And then place the right hand down. Bring your forehead into the top of the right other palm and just breathe here for a second. Inhale. Exhale. Superb. We're going to flip the stack of the palms. So now your right palm is under, left palm is on top. You're going to turn your head to the left side, just like you would if you were lying on a beach bed. Very nice and relaxed. But there is an intention. We're going to release the top right side of the neck all the way into that right armpit area, left armpit area. Encouraging a gentle twist of the neck. Also slight sort of rotation in the thoracic, but with a good amount of hip extension. Long big breath in. Long big breath out. Keep the feet pointed. Amazing. And then from here, we're going to bring the head down to the top of the right palm, left base of the palm to the top of the left side of the head. So just sandwich the head and breathe here for a second. And then as you exhale, I want you to just feel like you're lifting the elbow to the ceiling. You're not going to lift the left side of the pubic bone or the left side of the hip up. You're just opening from the chest. Inhale, left elbow taps maybe to the floor. And exhale to open. I love this move because
really, there is no cheating because your lower body's in a closed chain. And you will feel this exactly where it gets tight. It should feel like it's along the bra line and deep into the ribs. And then across the pec, of course. My left side feels so tight. Good. Left elbow down, one more. And exhale to lift. Here we go. We're going to lift. Up, up, up. Keep your gaze to the left. Push with the left forearm. Keep push with the right forearm. Keep pushing that right forearm down, but pull the right shoulder towards the ear. Don't let it travel up. And then down. Inhale. And exhale to lift. So good. Inhale. And exhale. Amazing. Inhale. Last one, exhale. And then as you lift, reach the left hand for the left ankle. The palm will face to the right side, thumb is down. And release. Left palm just on top of the right. Forehead down. Just breathe here for a second. Good. I want you just to shove the box away. And you're going to just come and lay long on your mat in a prone position, just like you did. You can have any palm stacked on top, whichever feels good. Bring the feet together, heels together, toes pointed into the mat. So we're getting a little bit of foot activity here. And I just want you to breathe. Inhaling into the back of the ribs. And exhaling. Good. Inhale. And exhale. Long big breath in. Long big breath out. So good. Okay, we're going to just turn over, grabbing our strap and our short loop band for this one. Oh, I feel so much lighter. If you feel lightheaded, just take a second. I just have to put my glasses on. This is a real faff with my glasses. I don't really do anything with glasses on, so it's a big adjustment.
The same way.
Okay, so we're gonna work two things at the same time, just killing two birds with one stone. So you're gonna grab your strap, and then you're gonna just place it just around the midpoint between your knees and your ankles, slightly more snug than hip distance. And then what you're going to do is you're going to place the feet where you can actually try and get the toes down onto the floor. So this is, again, a little bit of footwork. Okay, and then you're just going to abduct the strap very slightly. And what this is going to do is going to activate the hamstrings, and it's going to certainly activate the external rotators of the hip, which will eventually release your pelvis. And then you're going to grab your short loop band, really lightweight band, and you're going to stick it just around your forearms. So again, the midpoint between your elbows and your wrists. And then you're going to sit really nice and tall. So spine is kind of leaning upwards with the pelvis kind of pulling down. And your palms are facing each other, and I want the fingers really, really nice and wide. Now, all we're going to do from here is we are going to keep the spine up and tall as we rotate to the left. And you're going to exhale. Good. And as you rotate to the left, I want you to pull the right knee outwards into the strap just a little bit more. Keep the feet grounded, feet aren't peeling. So there's a sort of contralateral movement. We're moving the torso to the left, but the strap is pulling us to the right. And then we're going to inhale, release the straps back to center. And then exhale to the right, we pull the left side a bit more with the strap, the leg strap. And then inhale. And there is a very gentle pull of the arms into the strap. It's not much. Exhale to the left. Now we can pull the strap a bit more with the arms, the right side of the strap with the right leg. Back to center, inhale. Exhale to the right side. Armband pull, left side of the leg pull. Good, inhale center. And then exhale to the left. Right side pull. Now from here, with the pull of the armband, we're going to reach the arms up towards the ceiling in an elevation. And then once you get there, I want you to see if you can turn 1 more inch to the left. Back to center, arms release. Perfect. To the right side, pull the strap, both of them, the left side with the leg and the armband slightly, and then reach the arms forwards and up. And down, and back to center. We've got 2 on each side to go. Exhale to the left. Keep trying to roll the chest up and elevate the shoulders to the ceiling. Good. Any shaking, that's all very normal. Inhale down, back to center. Exhale to the left. Reach the arms up. Good, and down. We've got 1 more each side. My arms are on fire. And then exhale to lift. See if you can twist and hold. Here we're going to hold 5, 4, 3, 2, 1. I want you to drop your elbows or the hands or the forearms, wherever you can get, out to the right side, left side. So my right forearm doesn't quite get down, but the sides of my hands get down. So I want you to just feel like you're down and tuck your chin down towards your throat. Even if you cupcake the fingers here, I'm okay with that. I just want you to feel this massive release in the ribs. Right butt cheek can lift slightly off the ground, but not too much. Use that strap to see if you can pull that right cheek down. Amazing, and release. We're just gonna twist up towards the right. And then lower down with both your hands outside the right pocket, maybe 5 or 6 inches away from the pocket. As you lower the chin, tuck the chin into the throat. Keep the toes down if you can. Breathe here. One side of this side feels really, really hard for me on that left side, so just being patient. Why am I just being patient with myself? Inhaling and exhaling. So good. And release. Good. And then what I'm going to get you to do from here is just come onto all fours. Last little bit here, and then we're going to just come onto our cushion for a deep sort of shoulder release. That's it. Okay, and then from here, we've just got the toes tucked, hands stacked underneath the shoulders, fingers wide, elbow creases turned forwards. And I want your gaze to be about 1 or 2 feet in front of your fingertip line. Now from here, we're just going to reach the left foot back, keep the left toes into the mat, and keep the left foot active, left glute active. And then you're going to reach the right hand, maybe a step forwards on the top right corner of the mat. And then I want you to bend both your elbows and feel like you're pulling both your hands into the mat, but they're not going to move. So you're creating some resistance. Right elbow stays off the ground. And then just tuck your chin and look down towards the left foot. Just breathe. Inhale. And exhale. Inhale. Good, and exhale. Right hand slides underneath the shoulder. Left knee comes in. Right foot steps back. Right toes are tucked. Really good. From here, slide the left hand forwards. Imagine you are pulling both the hands like as if they're like sort of stuck into the mat or the ground, but you want to feel like they're pulling, and that left elbow stays in line with the left shoulder. You pull down, left elbow doesn't get to the floor, and your right elbow also bends into the rib cage. And then you drop your head, and there should be some resistance in your biceps, triceps, and the shoulders. Big breath here. And exhale. Big breath here. And exhale. One last time. Amazing. And release. Right knee in. Just come and sit in a hero's pose. So feet together, toes pointed. Just try and bring the heels on top of bum onto the heels. We're just here for a few seconds. Interlace the hands, flip them up towards the ceiling. Reach the arms up as you drop the head gently backwards. Nothing too severe, nothing too vigorous. Just go to your range of motion. Keep the mouth nice and loose. Long, big breath in. And again, inhale. And exhale. Really good. And release. And then just to finish, I want you to grab your cushion. You can even use 2 cushions if you need. And you're going to lay it down just sort of horizontally across your mat. And I want your bra line and the space between your shoulder blades just on top of that cushion. Feet can be a little bit wide if you need them. Yep. And then you're just going to lean over this cushion, like a little bit like a fish pose. So the chest is a little bit sort of expanded towards the ceiling, and the back of the skull hits the floor. And it should just feel like a dream as soon as you come into it. Lower back should feel like it's releasing, pelvis should feel really good, arms should feel really soft, chest should feel like it opens. Mouth is slightly ajar. Let the feet drop out if that's what happens. And we're just going to do a few rounds of box breathing in this position. So box breath is 4 seconds of an inhale through the nose, a hold or a pause for 4 seconds, and an out breath through pursed lips of 4 seconds. We're going to do 6 rounds just here. Nothing too intense, nothing too rigorous. You just want to hold this. You just want to go as far as you can. Draw breath in like you were just breathing air through your nose. Okay, so keep your fingers relaxed. Tongue dropping to the back of the skull, eyeballs dropping to the back of the head. And when you're ready, breathing in through the nose for 1, 2, 3, 4. Hold. 2, 3, 4. Out through pursed lips for 2, 3, 4. Short hold for 2, 1. And then inhale again for 1, 2, 3, 4. Hold. 2, 3, 4. Out through pursed lips for 2, 3, 4. Hold. 2. Inhale for 2, 3, 4. Hold. 2, 3, 4. Exhale for 2, 3, 4. Hold. 2. Inhale. 2, 3, 4. Hold. 2, 3, 4. Out. 2, 3, 4. Hold. 2. Inhale. 2, 3, 4. Hold. 2, 3, 4. Out. 2, 3, 4, 5, 6, and relax. Let your body just melt into its natural sleep-like rhythm. Feet are relaxed, Shins and calves relaxed. Thighs and hamstrings dropping heavy into the floor. Pelvis feels hollow. Abdominals, ribcage also hollow and wide. Chest open. Arms and wrists are soft. Top of the shoulders relaxed. Back of the neck and your throat release. No distension in the jaw, the mouth, cheekbones, sinus cavity opening, space between the center of your eyebrows wide. An expansive space through the crown of the head. Amazing. Start to wriggle out the feet and your hands very gently. And just roll over with your head coming onto the cushion as you roll over to whichever side feels comfortable. So just moving the cushion to rest your side of the head on the cushion, and just breathe here, curled up for just a few seconds before you try and sit up. And very gently coming to sit. Just taking a moment just to check in with how you feel. Lengthen your spine. Sit bones right to left. Your jaw, cheekbones, shoulders, and your hips. And gently opening up your eyes when you feel ready. I hope that felt good for you, as it did for me.